low risk, about 1% risk of stroke as well. And it's just that how it will help is because we have two results from two different tests. At least we will know how the flow is. If but my feeling is you have clot still there.
So I just want to confirm the CT scan showed up negative when I first got here, but the more intensive MRA or whatever it's called, the MRI scans are showing that there's
that's
definitely some, maybe even a lot of
Yes.
blockage.
And you had it before when we did your CAT scan and MRI in July.
Yes, I
And
got
then
it.
I saw that CAT scan showed decent flow and MRI showed not so good flow even at that time.
Mhm.
So if you have this, we can look at the flow, but MRI is a very good test to show clot.
Okay.
So what if they think it is clot? It probably is clot. It's just that how occlusive is this? Is there good enough flow? Sometimes we do endovascular treatment of clot.
I'm having difficulties hearing.
Sometimes we put endovascular treatment where we pull the clot out, but you are not a candidate for that. Typically, you have to fail medical treatment. Clot has to be very extensive, and
It's like a
just
last ditch worst case
last
scenario.
ditch. It is last kind of last ditch. I would presume hydration and anticoagulation. Maybe you need stronger anticoagulation. If you were really compliant, please make it clear to the team.
Yeah, I don't know where they came up with that. I mean, I was taking it once a day, and I came here at around 4 o'clock or so
Was
because
it
my
BID or
ophthalmologist.
once a day dose?
No, the VA had switched it once I ran out of the first scripts that you guys had gave me twice a day. The VA had switched it over to once a day, 20 milligrams on the Xarelto. And I've been taking that dead on. And the thing of it is I was taking it once a day. Typically toward the evening time, the eye appointment wasn't until 3:15.
Well, there are other medicines and sometimes injections. People who have the medicines are not.
And I don't
working.
know how good I would be with injections. Needles scare me, and I don't know how to do all this, Doc. I'll be honest with you. I'm
they
not
will
saying
educate
no.
you on that. But if it is truly that it's not going away and your headache is increasing and your papilledema, the eye swelling is there, and if it continues to increase, then you might have to resort to stronger treatments.
You got to do what you got to do. So if you're suggesting this procedure of running a tube basically from there to my neck or whatever, let's just do what you're suggesting. So
Yeah, I think
I think that there might have to be some kind of
it might help, especially radiologists spoke with me and Dr. Collins spoke with me, and both of them were concerned, and they would like to know how the flow is. This is the best I can offer. Let me see if. And the problem is because you are on blood thinners, you are at a little bit higher risk for bleeding, as you would imagine.
But they said 6 hours and it would run out of the system. That's why they switched me from Xarelto to.
Yes. No, I mean for my procedure.
Uh,
So we will definitely stop it at 2 because I
Okay.
don't want you to be 100% out.
okay.
But certainly we don't want you to be that high.
So where is this tube running? Where is this tube starting and ending at again? Because this
So-
is freaking me out.
So these arteries are all connected. Here, everything is connected. It's
Okay.
like a tree.
Okay.
My preference would be, if we can get it, is
From the
get
wrist?
a very small tube here in the
Okay.
wrist, because then it will be easier to control the bleeding like this.
Okay.
Yeah.
I see that.
Rather than there, it's a bigger one and you
Yeah.
put a lot of pressure, and then you're lying flat for a few hours. Here you can sit up and
Okay.
you
That
just
makes
have to
sense.
hold pressure.
So from the wrist onto
From
the
the
arm?
wrist, that would be my preference. Go through the arm,
Okay.
take a tube under X-ray, and check your artery right side. And if
Mhm.
that gives you an answer, that's great. If not, then check the left side.
So basically it's going through the neck area and the heart area?
Heart is down.
Okay.
We
Oh,
bypass
yeah.
the heart
Okay.
completely,
Oh, okay.
and we just go like this and
Up through the neck?
up through the neck.
Okay.
Come down and then go and select.
It sounds terrible, but I
No,
mean,
it's
I
done-
need some help.
It's
so.
done on routine basis. We do hundreds of them, so
Okay.
it's
I don't see why we don't run with it, Doc. I'm really tired of being this way.
But this is not a therapeutic. Okay, there are differences. One
It's
is
not going to fix it. It's just
not
trying
gonna
to
fix
resolve
it.
it.
Your first fixing has to be this.
Okay.
And given that you took Xarelto, and I do not know if once a day higher dose is as effective as twice a day. That part you have to ask the medical doctors. But what I would suggest is, if you do have clot, despite what you did,
Mm-hmm.
then you might have to consider alternative medical management, including injections. They may sound terrible, but if you do it, at least we know that it will stop the progression of clot, hopefully, and then you can have an imaging in 3 to 6 months to see how things are opening up. And stay super well hydrated, follow up with hematologist. We do not have any, I did not see any major consultation from hematologist, so I don't know where you got it done.
Yeah.
So we need to see those, and Dr. Collins will take care. However, this is kind of, I'm giving you an overview,
Understood.
and should be okay. You're doing okay. Don't worry. You'll be okay.
Well, I tell you what, I'm glad I came here because when I got out of the VA refused to give me any pain management. They refused to do anything for me. So it's kind of why I came back to here instead of even messing with them.
Yeah. Let
So,
me quickly examine you.
yes,
Look
sir.
here. How
Yes,
many
sir.
fingers?
In total, 3,
How many?
10.
Show me your teeth. Tap your fingers. Tap, 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 tap. Squeeze my hands, please. Bend your elbows. Push me away. Feel my touch. Same. Same.
No.
What's the difference?
I'm already partially numb on the left side. Yeah. I'm already partially numb on the left side.
Push me away. Push. This is different than this.
Yeah, years ago they never gave me an explanation as to why they said I didn't have a stroke, but I had an outer body experience, which made my whole body go numb, and then it eventually stayed forever.
It's
on my
been
left
ongoing
side.
for a while.
Forever, since 2007, never gone away.
On the left arm.
Yeah, even my
Face.
forehead skin, my taste buds changed.
And this too.
Yes.
Are you recording our?
Yeah, I am. Yeah,
What
it's
should
not.
we-
It's not for you. I have a medical doctor who's a friend of mine, and she wants to know what's going on. That's all. Yeah, it's not for anybody else but for her. So
Okay,
she's
we
an
can talk
internal
to them
medicine.
if you would like.
Yeah, she's in a different state helping. We'll call them people that need medical help that are allegedly supposed to be here. So she can't use her phone while she's there. So she's asked for me to take notes so that I can forward to her. And she just wants to make sure, she wants to make sure I get that LP, that lumbar puncture or whatever it's called. And she thinks that that'll resolve it, but she needs to know what's going on. And I
I'll
trust
defer
her.
that to Dr. Collins.
Yeah.
Uh,
Yeah, it ain't nothing but just because I don't remember all the things you guys talk about, and when she has an opportunity, she's not allowed to have phones there while she's helping
Yeah.
out the,
Let me know.
people.
Are you married?
no,
Any
No.
other family members?
no.
No one? No.
I mean, I've got a handful of friends here, but
Just
you
friends?
know what I mean?
So parents, siblings,
no,
first degree relative.
no. My biological mother sent me some text messages yesterday, telling me what she could find out on health issues in the family. But some of the things she was talking about, I don't know what she's talking
Do you
about.
want us to contact them? You said your mom.
Yeah, my biological mother. Well, I can show you what she sent me in a text about the health issues. I just don't know what all this
But,
stuff means.
Okay.
I'm going to cut this off because I think we're done talking about,